WHO obviously advises the use of medical and N95 respirator masks in a healthcare environment, and I think our guidance is quite clear on that, and we want to see that type of material reserved for use in that environment. However, there's been a very healthy global debate around the use of masks more broadly, or face coverings more broadly at societal level. WHO has been clear that there is no specific evidence to suggest that a mask may protect you from infection, equally a mask may provide protection for others. If you happen to be symptomatic and coughing, it might stop you contaminating somebody else. There are a number of issues around the broader use of masks. One, in that it may divert mask use from the healthcare setting, and that's something that just cannot happen. There are issues around wearing those face coverings and disinfecting those face coverings and disposing of those face coverings or masks, and the fact that putting on and off those masks involves people often touching their face as well, and therefore it cannot be done outside the context of very clean hands and proper personal hygiene. And also, masks are not an alternative to lockdown. And we've said this publicly again and again. WHO will support countries who wish to implement a more broad-based strategy of mask wearing or face covering wearing on a broader basis, as long as it's part of a comprehensive strategy, as long as it's linked to the things we said before: community education, personal hygiene, a strategy to find, test and isolate cases. If mask use is added to that, then I think that WHO can see the value. But if mask use is used as an alternative to those public health strategies, if it's used as a reason not to do those other things, then we believe that is the kind of policy that's counterproductive. So we see mask use in the broader context of a comprehensive strategy, and in that sense we'll support member states who wish to introduce that, as long as it does not take masks out of the healthcare environment, and people know how to wear them, know how to dispose of them, and are doing all the other things that they need to do. Maria?
Just to add, with the comprehensive strategy that Mike just mentioned, it includes also physical distancing, it includes hand hygiene, it includes respiratory etiquette, it includes staying home if you're unwell, it includes cases being isolated, confirmed cases being isolated, it includes contacts being in quarantine, and it includes following, the directives of the national governments if there are stay-at-home orders in place, and of course overall having an empowered community to know what they can do to protect themselves and their families. So as Mike has said, it's part of a comprehensive approach. It cannot be used alone. But we support governments in making these decisions, and in our recent updated guidance we've put some considerations that they may take into account when making these decisions. For example, if physical distancing is not possible in certain communities or certain populations, perhaps the use of a face covering or a non-medical mask may be useful there. And so we, like Mike says, we support these decisions being made, but as part of a comprehensive approach.
And if I could just supplement, one of the consequences we really don't want to see happen as lockdowns are eased, there'll be, there is huge pressure on people to go back to work, to go back to school, to participate in daily life. I don't want to be the person at home with a fever and with a job to go to, where I can make a calculation that instead of picking up the phone and phoning my health provider or phoning the public health authorities and asking for a test and a diagnosis, that I think that putting a mask on is an adequate response to that situation. And that is something we really have to be careful about. You may be inadvertently sick, you may not know, but it's something we have to think about very, very carefully. And that's why everything we do in public health or in health or in policy affects something else. So the pressures on people to go back to work are going to be very strong and very appropriate. But we don't want people having to make difficult choices and in some way think that putting a mask on is the same as staying home and reporting the fact that you're sick to authorities.